Like it's 26 minutes to 3 o'clock. Now, in the last 24 hours, just over 9,500 new coronavirus cases have been reported, though the number of hospital admissions has increased. Daily deaths are down roughly 40% at 205. KwaZulu-Natal still leads with infections, with the Western Cape a close second. Dr. Ridhwaan Suliman, a CSIR senior researcher, is going to talk to us now about these latest numbers and the trends. He's joining us now on the Midday View. Dr. Suliman, good afternoon. Welcome to the Midday View. Just first up, I was looking at one of the last tweets you did on your timeline, talking about the 7-day average of confirmed COVID-19 cases in South Africa finally dipping below 10K per day, first time since breaching this level mid-June. Are we now sort of, so to speak, getting away from the third wave, which has really been gripping the country badly?
Good afternoon, Dan. So nationally, we are seeing promising signs where we are on a significant downward trend in those leading indicators of confirmed cases and test positivity rate. And yes, as you mentioned, this third wave has been significantly long and quite devastating. So hopefully these are promising signs that we are on our way towards exiting the third wave. If we look more closely at the numbers for those leading indicators, the 7-day average of confirmed cases nationally is now just about 9,300 cases per day on average over the past week. And that's now shown a promising decline of 22% week on week. This decline in cases is confirmed by the decline in the test positivity rate, where this indicator on average is now at 17.3% nationally. And has also declined from just over 20% about a week ago. So while these numbers are high, I think the downward trend in these leading indicators is promising.
You know, looking at the graphs that you put out on your Twitter timeline, for example, on your social media posts, you look at this current wave, it's been stubbornly high, I mean, for a long time, and it's still sitting above higher than the winter wave of 2020 and the summer wave of 2021. I mean, that's a number, that's a graph, that's a trend. What could have made this to be so high, to be much higher than what we saw before? Was it the Delta variant?
I think there's probably two factors that are contributing to the trend that we see nationally. Certainly, as you indicate, this Delta variant has been dominant throughout this third wave across all of the provinces. We know that it's much more transmissible than the previously dominant variants, about twice as transmissible as the previous Beta variant, which was dominant during the second wave over last summer. And so certainly Delta has been driving this third wave and driving the number of infections as well as hospitalizations and deaths that we've seen in this third wave. Additionally, I think we also need to understand that this third wave the timing has varied between the different provinces, where we saw the inland provinces, in particularly Gauteng, surging much earlier on during this third wave. There was a bit of a lag before we saw an increase in the coastal provinces of Western Cape, KwaZulu-Natal, and Eastern Cape. So I think the variation in and the difference in the timing of the increase between the provinces has led to a more sustained third wave that we have been experiencing.
Okay, very briefly, while I have you, Dr. Suliman, there are fears concerned about a possible fourth wave later this year, October, November. We don't know. And then we are hearing about another variant, C.1.2. I mean, I'm just thinking if we had another wave, I don't know if you could tell now from the trends you're seeing locally and globally, could we expect worse than the third wave, or it will depend on how far we are vaccinated by the time the fourth wave hits us, if it hits us?
It's very difficult to predict, and there's so many different factors at play, including, as you mentioned, and certainly we will see more variants. I mean, it's just the nature of the virus that it will continue to mutate, but it's how those variants will behave, whether they will be more transmissible or severe. I think it's anyone's guess. We also need to, it's difficult to predict sort of behavioral patterns and sort of adherence to non-pharmaceutical interventions. We have to wait and see see what the effects of the vaccinations will be. We still don't have any significant data on the outcomes by vaccination status. So there's certainly a lot of unknowns. I think we also need to try and understand what the seroprevalence levels are. So while we do expect, given the previous trends in these past 3 waves, that there likely will be an upcoming surge later this year, probably closer to November or December, how significant or how severe that will be is anyone's guess. I think the take-home message at this stage is we just need to try and limit transmission of the virus, and the virus can't mutate if it can't replicate, and so certainly we have to try and limit transmission as much as possible going forward.
Dr. Suliman, if you've not been thanked already, I mean, the brilliant work you do on social media, keeping us up to date with the trends, some of us really appreciate it. Thank you very much. Keep it up. Stay safe. And thank you very much for joining me here on the Midday View this hour on eNCA. Dr. Ridhwaan Suliman, who's a senior researcher at CSIR. If you were not aware, he's on Twitter. Of course, you can track him there and follow him there as he updates us and keeps us updated about the trends of the levels of infection in the country.